Child Illness Guide, How to Administer Epinephrine EpiPen. Imagine your child suddenly starts having trouble breathing, their face swells up, or they break out in hives all over. These are signs of a severe allergic reaction called anaphylaxis. It can happen very quickly and needs immediate action. One of the most important tools in such emergencies is an epinephrine auto-injector, commonly known as an EpiPen. Knowing how to use it properly can save your child's life. First, recognize when to use the EpiPen. If your child shows signs like difficulty breathing, wheezing, swelling of the face or throat, hives, or sudden weakness, it's time to act. Even if you're unsure, it's better to give the injection because allergic reactions can worsen fast. Always follow your child's allergy action plan if they have one, and consult your healthcare provider for specific guidance. Next, prepare the EpiPen. Find the correct dose based on your child's weight. For children weighing between 7.5 and 20 kilograms, use the EpiPen Junior with 150 micrograms of epinephrine. For children over 20 kilograms, use the standard 300 microgram EpiPen. Remove the device from its case carefully, holding it firmly in your fist without covering either end. Then remove the safety cap, which is usually blue or gray, to activate the device. When ready to give the injection, position your child's leg so the outer thigh is exposed. The injection should go into the middle of the outer thigh, about halfway between the hip and the knee. Press the orange or red tip of the EpiPen firmly against the thigh at a right angle. You will hear a click, which means the needle has deployed. The injection can be given through clothing if necessary. Hold the device in place for about 10 seconds to ensure the full dose is delivered. After the injection, remove the EpiPen and gently massage the injection site for 10 seconds to help absorption. Call emergency services immediately, even if your child's symptoms improve. It's crucial to get your child to a medical facility for observation because symptoms can come back or worsen. If symptoms do not improve within 5 to 15 minutes, you may need to use a second EpiPen if available. Always follow your healthcare provider's instructions about carrying and using the device. Remember, children at risk of severe allergic reactions should have a personalized allergy and anaphylaxis emergency plan. Caregivers and parents should be trained by healthcare professionals at least once a year on how to use the EpiPen correctly. Children often learn to carry and use their own epinephrine between ages 9 and 14, depending on their maturity and ability to recognize symptoms. It's important to note that no child has ever died or experienced serious harm from a standard dose of epinephrine when used properly, so don't hesitate to act if you suspect an emergency. After administering the medication, your child should be monitored in a medical setting for at least 4 hours because of the risk of a biphasic reaction, which is a second wave of symptoms that can happen hours later. Always seek professional medical advice for personalized care and training. Knowing how to use an EpiPen correctly can make all the difference in an emergency, so be prepared, stay calm, and act quickly to protect your child's health.